Skin cancer is an oncological disease. Look at this picture, shows that different types of skin cancer and PET scan, MRI findings and CT detail going on. Introduction. Skin cancer is one of the most common form of cancer, arising from the abnormal growth of skin cells. It typically develops on skin exposed to the sun, but can also occur in areas not ordinarily exposed to sunlight. Definition. Skin cancer is the abnormal growth of skin cells, typically developing on skin exposed to the sunlight. Can also occur in less exposed area. It arises when mutations in DNA of skin cells cause uncontrolled cell growth. If left untreated, these abnormal cells can invade other tissues and organs. Types. 1. Basal cell carcinoma. The most common type arising from the basal cells in the epidermis. 2. Squamous cell carcinoma, originated in the squamous cells found in the outer layer of the skin. 3. Melanoma, the most dangerous form developing from the melanocytes, the cells responsible for skin pigmentation. 4. Merkel cell carcinoma, a rare but aggressive type that originates in hormone producing cells just beneath the skin and in hair follicles. 5. Lymphoma of the skin, rare type that begins in the lymphocytes, a kind of white blood cell. Causes. The primary cause of skin cancer is exposure to ultraviolet UV radiation from the sun or tanning beds. Other causes include 1. Genetic predisposition. 2. Exposure to toxic substances. 3. Compromised immune system. 4. Previous skin cancer diagnosis. Risk factors. 1. Fair skin, light hair and eye color. 2. History of sunburns, particularly early in life. 3. Excessive sun exposure. 4. Presence of many or typical mole. 5. Family history of skin cancer. 6. Use of tanning beds. 7. Older age. Complications. 1. Metastasis to other organs. 2. Disfigurement and scarring from treatment. 3. Recurrence of cancer. 4. Emotional and psychological distress. Pathophysiology. Skin cancer develops when errors, mutations occur in the DNA of skin cells. This mutation causes the cells to grow uncontrollably and form a mass of cancer cells. UV radiation can damage the DNA in skin cells, leading to this mutation. Steps or process going on. First step, exposure to carcinogens. 2. DNA damage. 3. Failure of DNA repair mechanisms. 4. Cellular mutations. 5. Uncontrolled cell proliferation. 6. Tumor formation. 7. Local invasion. 8. Metastasis. 9. Immune system evasion. Signs and symptoms. 1. A new growth or scar that does not heal. 2. Changes in existing moles such as size, shape or color. 3. A raw, scaly red or brown patch. 4. A purely or translucent palm. 5. Painful lesions that itch or burn. Diagnosis. 1. Physical examination, visual inspections by the healthcare provider. 2. Biopsy, removal and examination of a suspicious skin lesion. 3. Dermatoscopy, using a special magnifying tool to examine the skin. 4. Imaging test. If metastasis is suspected, imaging tests like CT scan, MRI, PET scan may be used. Nursing diagnosis. 1. Impaired skin integrity related to presence of lesions. 2. Acute pain related to cancerous lesions and treatment procedures. 3. Anxiety related to diagnosis and fear of cancer progression. 4. Risk for infection related to open skin lesions and treatment. Management. 1. Regular skin examination. 2. Patients' education on skin protection. 3. Emotional support and counseling. 4. Pain management. Treatment. 1. Surgical excision, removing the cancerous tissue. 2. Mohs surgery, layer by layer removal of cancerous tissue. 3. Cryotherapy, freezing of cancer cells. 4. Radiation therapy, using high energy rays to kill cancer cells. 5. Chemotherapy, using drugs to kill cancer cells. 6. Immunotherapy, boosting the immune system to fight cancer. 7. Targeted therapy, drugs targeted specific aspects of cancer cells. Psychosocial medicine. 1. Support groups for emotional and psychological support. 2. Counseling services for patients and families. 3. Addressing body images issues, self-esteem. 4. Stress management techniques. Prevention. 1. Avoid excessive sun exposure and tanning beds. 2. Use sunscreen with high SPF. 3. Wear protective clothing, hats and sunglasses. 4. Regular self-examination and professional skin checks. 5. Avoid smoking and reduce alcohol consumption. 6. Maintain a healthy diet and lifestyle. In conclusion, skin cancer, while common, can often be prevented through proper skin care and protection. Early detection and treatment are crucial for favorable outcome. Nurses play a vital role in educating patients, providing care and supporting those affected by this disease. Thank you. Have a nice day.